Okay, so let's moving on another mechanism of labor, which is torsion of neck. What happened in that? In internal rotation, we have learned about that how head internally rotate on the pelvic floor rotation into anterior posterior. Now at this side in anterior posterior from transverse to anterior posterior diameter of maternal pelvis, what happened? Torsion of neck means neck twisting, neck internally twist. Okay, I have already given you example of small gap and one round ball. In that round ball represent fetal head. So twisting of neck when head internally rotate from transverse to anterior posterior diameter from asynclitism to synclitism. Okay, I have already explained in previous lecture what is asynclitism and synclitism. So what happen in this? If the shoulder remain in anterior posterior diameter, okay, now head needs to come out, so the neck has to sustain a torsion twist by 2/8 of circle. Okay, in this rotation into anterior posterior diameter, this happen in a deeply engagement after it descent and then it internally rotate. So now head needs to come out. So before crowning it happen, but the neck fails to withstand such major degree of torsion, and as such there will be some amount of simultaneous rotation of the shoulder in same direction, the extent of 1/8 circle of placing the shoulder to lie in oblique diameter with 1/8 of torsion still left behind. Okay, now as I explained you before, head cannot glide directly. Okay, it has to be in a internal rotation motion. So what happened from this 2/8, now from transfer to anterior posterior, now it will be towards 1/8 circle on which line? Oblique line. So it can be crowned after and then easily pass out. Okay, so shoulder move to occupy. In order to that, what happen? Shoulder are move, okay, on left side, as you can see crowning and then head delivery, like this. Okay, what happened before that? See, shoulder needs to left bend left side. Okay, in order to why? In order to occupy left oblique diameter in left occipitolateral position to right oblique diameter in right occipitolateral position. Okay, and now crowning will happen. Crowning means now vertex, okay, or vertex presentation, sorry, cephalic presentation, vertex presenting part now appear. As you can see, this one is bregma. Okay, this one is a vulva vaginal part. Now head actually come towards external environment. Crowning happen. In crowning, the maximum diameter of head biparietal diameter stretches the vulval outlet without any recession of the head, because already that will happen in internal rotation. Okay, so what happened even after the contraction is over called crowning of head. Okay, now what happened next? Extension. Now this head needs to expel out. Okay, assisted delivery of the head by extension, exerting an upward pressure. We need to pressure on upward side, not downward side. Why upward side? Because we cannot down the head like this. If we down the head, then neck, see, already neck is between what? Birth canal, vaginal canal. Okay, if we apply downward pressure, then what will happen? Neck will be injured. Okay, so we need to, what happen, one hand place on head, okay, then push push the head upside, okay, support downwardly, which side, this mandible side, support this, okay, and then gently push out head, okay. Other pressure will be push out from uterine contraction, from uterus to birth canal. So assisted delivery of the head by extension, exerting an upward pressure to the chin by the right hand, place over the anococcygeal ref, okay, between anus part and coccyx. Extension, this is called extension. So delivery of the head takes place by extension through couple of force, okay. Theory, the driving force pushes head in downward direction, okay, this one downward direction, while the pelvic floor offers a resistance in upward and forward direction. The downward and upward force neutralize, okay, this one upward, this one downward, so there is a balance, neutral position, okay. So the downward and upward force neutralize and remaining forward thrust, okay, this one is a maneuver which is called thrust, helps in extension the successive part of fetal head to be born through the stretches vulval outlet are vertex, brow and face. Vertex, brow means where frontal bone is end and facial part are likely to be started, okay. This one eyebrow glabellar part, that is called brow part, this one's facial feature. So what, in successive part of fetal head to be born through stretches vulval outlet are vertex, brow and face. So this one is a torsion of neck, crowning and extension, okay. Rest of mechanism we will be learning next part. Till then, happy learning.